Hello, my name is Dr. Darshini Ayton and I'm the Monash Partners Consumer and Community Involvement Fellow, and today I'm going to talk to you about the how of consumer and community involvement in research, in particular for laboratory-based research. This picture here is by Fern Siebler, a Melbourne artist, and what I wanted to draw your attention to is the use of gold leaf throughout this painting. And that is what consumer and community involvement is. It is about using and involving consumers throughout the research process so that they can lift and highlight the colour of the other colours around the gold. And that's the same sort of impact consumer and community involvement can have in research. So Monash Partners is a partnership of organisations, which you can see at the bottom, each of the logos there. So we have Health Services, Alfred Health, Cabrini, Eastern, Epworth, Monash Health and Peninsula Health. And we have universities and medical research institutes, so Baker, Burnett, Hudson and Monash University. We are an accredited Advanced Health Research and Translation Centre by the NHMRC, and we do work that is consumer-led and health services-led, and we'll talk about that a little bit more in a moment. Through the Monash Partners partnership, we have a population reach of about 3.5 million Victorians. As you can see in this circle here, we have a recent associate member of La Trobe Regional Hospital, and so that takes our reach further along the southeast corridor. The way we work is often in silos, and in a process that often lacks a systems approach. For example, the university is consisted of many faculties, of many schools within each faculties, of many departments within each faculty and within each school. And it's very hard sometimes to be able to work across those different systems and organisational hierarchies to be able to innovate and create for health outcomes and population outcomes. And so this siloed approach often means that we don't have a big picture understanding or collaboration or partnership that is happening. Monash Partners Academic Health Science Centre seeks to do things differently. So we seek to work not in silos and to connect researchers, clinicians and the community to innovate for better health. So to do this, we want to create communities of practice so that we are not busy running in our individual hamster wheels trying to solve health problems and health services problems by ourselves, but that we are all together in a sandpit, playing and working together to be able to create those innovations, those healthcare improvements, those health advances. A couple of years ago, Monash Partners went through a strategic priority process, and this is the outcome. So this is our plan at a glance. And so you can see that our purpose is right in the middle, to connect researchers, clinicians and the community to innovate for better health. And you can see our priorities and goals around in circles. So consumer and community involvement is one of the priorities, but also collaboration and partnership and stakeholder engagement, measuring success, clinical research facilitation, building a workforce to deliver better health through research, building a research, translation and impact culture, integrating across translational research continuum, integrating across the care continuum. In each of the corners, you can see some of our key priority pillars, so data-driven healthcare improvement and innovation through research and practice, health services research and implementation, and leading theme flagships to directly benefit our community. The clinical themes that make up Monash Partners, although we do operate broadly, and we had to nominate these themes when we were getting accredited by the NHMRC, but these include cancer and blood diseases, cardiovascular diseases, critical care, trauma and perioperative medicine, infection and inflammation, metabolic medicine, neuroscience, mental health and sleep, and women's and children's health. And these themes are supported by enabling platforms, so biomedical discovery research integration, clinical research facilitation, community and consumer involvement, data-driven healthcare and informatics, health services research, implementation and innovation, primary and community health, and workforce development. So Monash Partners is one of the Advanced Health Research Translation Centres. We were the first to be accredited by the NHMRC alongside Sydney Health Partners. But there are 7 Advanced Health Research Translation Centres and 3 centres for innovation in regional health that combine together to make the Australian Health Research Alliance. And you can see their logos here. And they work together to very much drive and recognise that community are the funders and beneficiaries of healthcare, and they're the funders and beneficiaries of health and medical research. And so working together to not make improving healthcare a competitive space, but that is something done in collaboration through strategic collaborative research, and that translation is fundamental to the work of the Australian Health Research Alliance. So, consumer and community involvement. How do you do it? Why do you do it? Tricia Greenhalgh, in one of her recent papers, a systematic review of the different frameworks for consumer and community involvement, or patient and public involvement as they call it in the UK, starts the review by saying it is a truth universally acknowledged by policymakers, researchers and research funding bodies that patients and the public should be involved in research, though there are different perspectives on what such involvement should look like. And so I hope by the end of this presentation I can give you a few insights into how you may involve consumers and the community in your research. It is useful to start by thinking about the different types or levels of involvement consumers may have in the research process. And so you can see here a triangle where at the very bottom we have informing. So this is where consumers provide information, feedback, build awareness, improve health literacy at kind of that basic level of involvement. Then you could go to consulting, which is seeking information and providing feedback, so having the consumer do that, understanding context, experience, motivation, communication of what your research project is aiming to do. And as you get further up, it becomes more intensive. So involving is a level of participation where the consumer is actively involved in information, support, policy, mentoring, understanding objectives, strategic thinking as part of your research process or healthcare improvement process. The next level up from there is partnership, so you work equally with the consumers in the work that you're doing. And then the very top is consumer-led. So this is where the consumer sets the priorities and is the lead of the major activities. So understanding that kind of hierarchy, I guess, of involvement or in participation helps to conceptualize how you may involve consumers. And here we have organizational capacity. So this has been adapted, or this is the framework that has been put out by Cancer Australia, and is worth having a read if you are interested in understanding this a little bit more. Here we have a similar concept around levels of involvement. So this was developed by our colleagues in Canada. And this really shows from the patient and researcher perspective about those different levels. So informing, participating, consulting, involving, collaborating, leading and supporting. And you can see that here the patient at the learn and inform is to ask questions and learn about how to get more involved. Participate is to act as a subject or participant in the research study. Consult is to provide feedback and advice on specific research activities. Involve is to work directly with the research team throughout the project. Collaborate is to partner on equal footing with the researchers, and lead and support is to make decisions and lead research activities. And you can see there for the researcher, for the learn and inform, provide information, listen, answer questions. Participate is to act ethically and respectively in how you conduct your research. Consult is to seek consumer input on an ad hoc basis. Involve is to include the consumers as a standing member of, say, a project advisory committee or a steering committee. To collaborate is to partner equally, and to lead and support is to follow the lead and support of the consumer. So, when thinking about, well, where do you start with consumer and community involvement, and how do I demonstrate that I'm involving consumers in my research? The NHMRC has put out this 8 steps in research journey, and it also links to their expectations and values for the framework of effective consumer and community engagement in research. So I think this provides a really good framework for you to be able to talk about at what stages of the research journey you're involving consumers. And we'll go through these one by one and provide some examples and ideas of what you might be able to do. The first one is building relationships. And so there are a number of different ways that you can do this. You can contact consumer organisations for the health condition that you are working in and have a look at their annual reports. See what they have written in terms of their priorities around healthcare, research, and use that as a basis to argue how you are addressing that as a priority. Also, often these consumer organisations do their own internal research to find out from their members what it is that they think is important. And so being able to source that or access that can also provide you with insights into that area. Reviewing the literature, particularly qualitative research, which highlights the patient voice in terms of the experience and needs of the patient, can be a very good way of being able to demonstrate that this is a need that the patient wants. You can also invite consumers or consumer organisations to your research meetings and pitch ideas and talk about some of the research that you're interested in. But there's also a lot that you can do by looking at websites. And so here we have a website for an endometriosis consumer organisation. And if you go through it, there's lots of patient blogs and information and advice. And so being able to go through and build a story about what that experience is from the patient perspective, what are some of their needs and wants. Also on Twitter, here you can see, the story of someone with PCOS, and so being able to link to these types of blogs, and that's just by using the hashtag PCOS, I found that. And then there are also a lot of podcasts which actually focus on the lived experience and healthcare needs and the stories of patients. And so here's one here, which is, I can't remember what it's called. Oh, No End in Sight podcast. And so Brianne Bennis has also done TED Talks, and so having a look at those types of resources and pulling out quotes or pulling out particular insights to support why your research is important and is consumer oriented. The next step is developing the research idea. To develop the research idea, you can involve consumers by asking them, well, what are the research questions that are important to them? You can present research ideas and ask consumers to either prioritize them, rank them, or rate them in terms of level of importance or how beneficial they think they are. And you can test your research ideas as to whether they make sense from a consumer perspective. This can be really helpful in terms of also developing lay summaries for your research, because if the consumer can't understand it, chances are it's not considered lay enough. And you can also get consumers to have input into grants and research proposals and ethics applications. So even for laboratory-based research, there are models where, for example, the Buddy program at the WeHi is where a consumer is matched to a research group and they meet together every 6 weeks, and they just talk about the different research that's happening, the research ideas, the grants that are going in, and the consumer provides input into that process. So it's quite informal, and it's more of a relationship building process, but it also provides an opportunity for the consumer voice to be captured. The next step in the research journey is developing the project and seeking agreement. In terms of this stage of the project, you can do a number of different processes. So for example, you can have consumers involved in project committees and advisory committees. You can also have consumers identify research outcomes that are important to the patients. So this is good for clinical research, and for example, We tend to focus a lot on clinical outcomes that we think are important, but what might be some of the patient outcomes that are important? Quality of life outcomes, general health and well-being outcomes that the consumers think would be important to measure to show impact of your research. Consumers can also advise on recruitment and data collection, particularly for clinical projects again. For example, how to recruit, where to recruit, processes that are going to be feasible for data collection. For example, is it going to be too much of a burden to have long interviews or focus groups? How do they feel about surveys? What's the best way to administer the survey? All of those types of things. One of the things that has been super helpful is having consumers provide feedback on participant information and consent forms. Often these are written in very formal and high language, and so being able to have someone with the lived experience of a condition or a lay perspective to provide some feedback on that wording has been invaluable. And in the same way, providing feedback on any of the interview, focus group questions, survey questions, assessment on follow-up protocols. For laboratory research, one of the things to consider is when your project is finished, how do you want consumers to understand it? And so having consumers involved at this stage where they're developing the project, seeking agreement as to why it's important, and having that narrative built in can be helpful. Collecting data. So that's the fourth step in the research journey. How can you involve consumers in this stage? Again, this may be more suitable to clinical projects or public health projects, but you can actually hire consumers as data collectors. They may be involved in administering surveys, doing interviews, being a co-facilitator of focus groups. I've recently involved consumers as co-hosts in virtual meetings for data collection. So workshops, focus groups, they've been involved in asking questions and facilitating discussion. But another thing for lab-based research, if you're collecting specimens from people, is getting feedback on those data collection protocols and are they feasible, reasonable, acceptable, and getting advice on the best way to do that. The next step is analysing the data and making sense of findings. So for some projects, it may be suitable to involve a consumer in your data analysis. So you can train your consumer and involve them in data analysis via different platforms considering COVID-19 times, so Microsoft Teams, Google Hangouts and Drives. We at Monash Partners have developed tip sheets on how to utilise each of these different platforms. And you can also present your data analysis to consumers at regular intervals for thoughts and perspectives. I think one of the things here is to think like a journalist. And if you think about any story that a journalist puts out there around health, medical research, they always seek the patient or consumer voice as to whether or not that person thinks it's a great idea. So whether that's a drug development, even if it's lab-based research, they will often say, well, what does that mean for the patient? And involving the consumer where you're presenting this data analysis and say, this is what we've found. You're not getting their input into how to analyze the data, but this is what we found. What would this mean to you? If we have developed up a new process to test for X, Y, and Z, or we have developed up a new drug that will be able to do this, what are your thoughts on that? How would you make sense of that? Can again give you the narrative to present your research findings in a way that is attractive or making sense to that consumer population. I've grouped these two together, so report writing and sharing and translating results into action. There's been a discussion on Twitter recently, and if you're interested in seeing tweets on this topic, the hashtag is #PPI, and that's for patient and public involvement or consumer and community involvement information, broadly speaking. But there's been a discussion around the need to include your consumers, patients as co-authors if they have had quite a significant input throughout the research process. So for example, if they've helped in prioritising your research ideas, provided advice on process, provided input into analysis, then it's quite reasonable to involve them as co-authors. Increasingly, conferences are wanting a consumer representative, and I went to a conference recently in the US where every presentation had a consumer and a researcher present together. So that was the PCORI conference, PCORI. And also championing your research. So, in terms of dissemination, who do you want to know about your research? And it might not be the paper, it might be a summary of your paper, but putting that information out on patient forums, via patient organisations, consumer organisations, can mean that there is much more interest and advocacy around the work that you are doing. The final step is to learn from experience and to have that opportunity to reflect and think about how did involving consumers, patients, community members impact or change the direction of your research, or impact or change or enhance how you did your research in terms of data collection, processes, analysis. And so having an ability to reflect on that and write that in, and it's become more common now in some of the key journals that that's an important process to be able to write whether or not patients and the public were involved, how were they involved, and what impact did they have. So this is a flow chart that was developed by a group involved in women's health research. And so I thought it was quite appropriate for this group here. And you can see PPI representatives at the bottom of the slide and how they were involved across the research continuum. So here we have a clinical problem, and the patient and public involvement representatives, or the consumers, were involved in research question prioritization. They selected patient outcomes. They helped develop funding applications as co-applicants. They joined study steering committees, and they assisted in developing data collection forms. They reviewed ethics applications. They developed the patient information literature. They developed strategies to troubleshoot problems such as recruitment, which we always have problems. They assisted in data analysis. They contributed to the interpretation of the study. They developed plain language summaries and disseminated outcomes via other media channels, which the researchers may not have had access to. And they were involved in shaping, changing, impacting on policy. And so the research, as you can see at the top end of the slide, did all of the other aspects which you would be very familiar with, but recognizing that here are the different ways that you can also involve the patients and the public, consumers and the community. Other things that you may need to think about is payment and reimbursement. So if you are asking consumers to contribute meaningfully to your research process, how much do you need to pay them and reimburse them depending on the activities that they're doing? And Monash Partners has a form which you can have a look at for advice on this. Also thinking about, who do your consumers represent? Do they represent your general public or perceptions? Do you need to try and recruit a specific population group to be your consumers? So just having a think about that. Having terms of references and position descriptions means that there's a clear expectation and scope around what their consumer role is, which can be really helpful. So we've involved consumer in doing some data analysis with us, but we're not expecting him to lead that, nor are we expecting him to do the grunt work. He's there to for us to present and for him to reflect and give us feedback on our interpretation. And so making that clear in the terms of reference means that they aren't disappointed if they're not involved more than they thought they were, but also gives scope to the amount of time that is required for that task. And also having training for researchers and consumers. So often the question that researchers or health professionals asks is that consumer right for my project? Whereas sometimes you need to think about is, am I the right researcher for that consumer? And do I have the skills and do I have the knowledge on how to do consumer and community involvement well? And Monash Partners is developing up training, and we have a website that provides a lot of resources and information about how to do consumer and community involvement and what skills and information researchers and health professionals need. Other opportunities for consumer and community involvement is to have consumers review, rank and rate research proposals for funding schemes. That's being increasingly emphasised. So they may not have veto rights, but they're able to provide comments and feedback as to whether or not they think the research proposals are good. And we're actually seeing that with the NHMRC, that they do have consumer panels that do review grants for specific schemes as to whether or not the projects meet a consumer need. Also, in the US and the UK, they have a Dragon's Den, so kind of like Shark Tank, where there's a consumer panel and researchers pitch their idea and see which ones are most likely from a consumer perspective to be funded. Thank you for listening. I hope that was helpful, and I wish you all the best with your research and healthcare improvement initiatives and projects. If you need any more advice or support, please find us at monashpartners.org.au. There is a consumer and community advice form on the consumer and community involvement page. So if you need any support, please reach out and we're happy to help.